Mandibular central incisor. Welcome back. In the last videos, we thoroughly explored the maxillary central and lateral incisors morphology. In this video, we shall shift our focus to the mandibular central incisor. It is the smallest tooth in the dental arches. Like the maxillary central incisors, there are also two in number, centered in the mandible, one on either side of the midline, with the mesial surface of each in contact with the mesial surface of the other. Beginning with its chronology. The initial signs of calcification become noticeable at around 3 to 4 months of age. Enamel formation is completed between 4 to 5 years of age. Eruption of the tooth usually occurs at approximately 6 to 7 years old. Finally, the root development is completed around 9 years of age. To conclude, let's now discuss its morphology from various aspects. Starting with the labial aspect. Tracing the outlines first, beginning with the mesial end of the cervical line. The mesial outline is almost straight until the crest of curvature or contact area, located incisal to the junction of the incisal and middle third. Afterward, it ends with a relatively sharp mesio-incisal angle. Following this, it proceeds with a straight incisal ridge, perpendicular to the long axis of the tooth, and terminates at the sharp disto-incisal angle. From there, the distal outline mirrors a similar pattern to the mesial side, with the crest of curvature situated almost at the same position. If you draw a line in the middle of the labial aspect, you will see that the two halves are mirror images of each other. This unique feature is known as bilateral symmetry and is a distinguishing characteristic of the mandibular central incisor, which is not present in the mandibular lateral incisor. Let's now turn the tooth to view from the lingual aspect. The lingual outline is the mirror image of the labial outline. The lingual surface is smooth. The lingual fossa is inconspicuous with less prominent mesial and distal marginal ridges. But in some cases, the marginal ridges become more prominent at the incisal third, thus making the concavity more distinct. The cervical third is marked with slight convexity by the cingulum. Moving on to the proximal aspects. The most important feature of mandibular incisors that is to be noted is that the tooth is wider labiolingually than mesiodistally. In other words, it appears broader from the mesial or distal aspect than from the labial or lingual aspect. If we observe the crown from the mesial aspect, we will be able to appreciate the incisal ridge, labial and lingual outlines, and cervical line. Direct your attention to the incisal ridge. Consider a line bisecting the root extending towards the crown. What is the relation between this line and the incisal ridge? Choose the correct option. A. Labial. B. Lingual. C. Incisal. D. Cervical. It's lingual. The line divides the tooth into two parts, labial and lingual. The incisal ridge is situated towards the lingual side. So remember, the labial faces of the mandibular incisors are inclined lingually so that the incisal ridges are lingual to a line bisecting the root. Next, let's observe the cervical line. It is curved incisally and extends up to 1/3 the length of the crown. Now trace the outline, starting from the labial most end of the cervical line. It follows a convexity in the middle of the cervical third, representing the labial crest of curvature, and then slopes straight up to the incisal ridge. From the rounded outline of the incisal ridge, it continues as a concave line, representing the lingual fossa at the middle third. Then it follows a convexity in the middle of the cervical third, representing the cingulum. What about the mesial surface characteristics? It is smooth and slightly convex at the incisal third, representing the mesial crest of curvature. Then, towards the middle third, it is flat. Note that there is a tendency to form a slight concavity between the middle third and cervical third. If we now turn the tooth to view from the distal aspect, it looks almost similar to the mesial aspect, except cervical line curves incisally 1 millimeter less than that on the mesial aspect. The concavity present on the distal surface appears more pronounced than on the mesial surface. Lastly, let's view the tooth from the incisal aspect. The incisal aspect further demonstrates the bilateral symmetry. It means the mesial and distal half look similar, and it will be difficult to differentiate between the two. Also, note that from this aspect it is clear that the crown is wider labiolingually than mesiodistally. We will also be able to see the incisal ridge and the labial and lingual surface from this aspect. Now let's draw a line bisecting the crown labiolingually. Note that the incisal ridge is perpendicular to this line. Further, the incisal ridge is lingually placed to the labiolingual midline. Like the maxillary incisors, we see that the labial surface is wider than the lingual surface mesiodistally, indicating the presence of lingual convergence. Have you not wondered how the mandibular central incisor is the smallest tooth in the dental arches? For that, let's look at its average dimensions. The cervico-incisal length is about 9.5 mm. The mesiodistal diameter is about 5 mm, while the labiolingual diameter is about 6 mm. However, the dimensions at the cervix are comparatively less and are about 3 mm mesiodistally and 5.3 mm labiolingually. The cervical curvatures are about 3 mm mesially and 2 mm distally. The root is only about 12.5 mm in length. Let's now discuss the root morphology. It follows the contours of the crown. It can be discussed from labial, lingual, mesial, and distal aspects. The mandibular central incisors consist of a single root. When viewed from the labial or lingual aspect, the mesial and distal outlines of the root are straight and taper evenly to the apical portion. In most cases, the root curves distally at the apical third. When viewed from the mesial or distal aspect, it appears broader than the labial or lingual aspect. The labial and lingual outlines are straight from the cervical line and then begin to taper from the middle third to end at a rounded apex. Another important characteristic of the mesial and distal surface of the root is the presence of developmental depression. It is more pronounced at the junction of the middle and apical thirds. However, note that the development depression on the distal surface is more marked and also presents with a deep developmental groove compared to the mesial surface. With this idea about the crown and root morphology, imagine two mandibular central incisors are given to you. How will you identify them as left or right mandibular incisors? This is done by identifying the mesial and distal sides. For this, we need to know their differentiating features. They are cervical line. It will be deeper on the mesial than the distal side. Developmental depression. This will be more pronounced on the distal surface. Developmental groove. Its presence indicates that it is the distal surface. Furthermore, when observing the tooth from either the labial or lingual aspect, identifying the curvature of the root, which typically inclines towards the distal side, can provide valuable insights. After identifying the mesial and distal sides, the next step is to locate it in the mandible. The mesial side would face towards the midline, while the distal surface would face away from the midline. Let's get back. Lastly, let's also discuss the pulp morphology of mandibular central incisors. Much like the crown, the pulp chamber exhibits a labiolingual width greater than its mesiodistal width. Within the root canal portion, there can be diverse configurations. The most frequent occurrence is a single canal with a solitary foramen. However, in uncommon instances, the canal may bifurcate labiolingually, ending in two distinct foramina. The cross-sectional shape of the root canal is typically either ovoid or round. Before we conclude, focus on the mandibular incisors in this image. Notice anything peculiar? It's a case of attrition. Attrition, a natural process of tooth wear, occurs gradually over time due to friction between opposing teeth, accelerated by habits such as clenching, grinding, and specific dietary choices. This process expedites wear on teeth. Consequently, dentinal sensitivity arises as the protective enamel wears down, exposing the underlying dentin. The mandibular incisors are the most common teeth to attrit. Given that attrition is a natural process over the years, let's examine another image of an adult patient displaying persistent mamelons. One would expect these to have worn down to a flat incisal surface ideally, right? However, factors like delayed tooth eruption, open bite, and malocclusion can influence this outcome. Before we wind up, let's summarize the video with a few takeaway points. The crown and root of the mandibular central incisor are wider labiolingually than mesiodistally. The mesial and distal crest of curvatures are incisal to the junction of the incisal and middle third of the crown. The labial and lingual crest of curvatures are in the middle of the cervical third of the crown. The tooth appears bilaterally symmetrical from the incisal aspect. There is a presence of developmental depressions on the mesial and distal aspect of the root that extends to the cervical and middle third of the crown. The depression on the distal aspect is more pronounced with a deep developmental groove. The incisal ridge is straight and it has a lingual inclination. That brings us to the end of the video. Hope you had fun learning with us.